Okay. So now major psychological disorders. Okay. Um, okay. The first one we are going with is anxiety disorders. So the word anxiety comes from Latin word anxietas, which means uneasy or troubled mind. Okay. Any definition you got to by heart. Okay. I also have all my definitions by heart. Like anxiety for me is an uneasiness, apprehension, and tension which stems from anticipating danger. Whereas here the definition is different, so you can remember the definition here. The one I remember is from the Encyclopedia of Mental Health. But now from here it's NOVA or LTSS idli. NOWWA, nervous or worried without any obvious reasons. So that is NOVA. Then or obvious reason, and LTS is long time such that it starts interfering with the daily life is called anxiety disorder. Two major types, generalized GAD and phobia. Okay, so GAD, we all feel tensed in our daily life due to various reasons. So generalized anxiety disorder is GAD. Okay, um, but it sometimes obviously stress is also tension and stress is also beneficial. Why? Because when we are yeah, because it makes us motivated to work. Okay, it's called eustress, EUSTRASS. You're motivated to work. It compels us to face difficulty. If life was boring and the same every day, it would have been, you know, what's the point? Okay, but when the mild or very basic tension becomes too intense and starts interfering with your daily routine, okay, as well as with your it starts interfering with your work, basically impairment, dysfunction, all of those things. Okay, that then you start feeling tensed or nervous without, and you start feeling tense or nervous without any reason. That is a problem. Okay, to diagnose any individual suffering from this disorder, the symptoms should be present for at least 4 weeks for children and 6 weeks for adults. And due to extreme nervousness, his capacity to solve problems may break down. So the thing with anxiety is that, see, for example, students, if you see, who feel extremely anxious, you know, they kind of end up messing up their exams. They are not able to give their exams. They're not able to, even though they're good students, they may not be able to pursue what they want because of anxiety or something like that. So basically your capacity to solve problems, a lot of other things start breaking down, and that is why you need to consult an expert. It's very important. Okay, now symptoms are extreme fear or of the unknown, increased heart rates, heartbeats, irritability, frequent headaches, worry, lack of sleep, vomiting, uneasiness, breathless, and blackouts. Okay, that happens when you're extremely anxious. In fact, you guys only need to by heart it, because we do see anxiety is very common in today's time. Okay, now the second type is phobic disorders. Okay, there are a lot of types of phobia. Okay, over here they've just given an example of acrophobia. Okay, which means that they've given this example of this guy who, when he went on top of a hill, he saw down. I mean, if you obviously you go on a high story building and then you see down, obviously you'll get scared. But people with acrophobia kind of feel extremely, they just can't take it. Okay, they can't sleep on upper berths in train and all of those. So that is phobia. Phobia basically is irrational fear. Okay, irrational means logically you're not, you know that it's nothing to be scared about. People who have, say, phobia about water, or phobia for about darkness, any kind of phobia, so you know that it's stupid. Okay, there's nothing harming in water, but you still have, they know that, okay, I'm this is irrational, it's not logical, but still I'm feeling it, right? So that is why it's called, it's a phobia and not a fear. Basically phobia comes from phobos, which is Greek god of fear. Okay, okay, some situations are not at all dangerous or less dangerous, and still if an individual feels intensely afraid, like you see dogs, or some people see dogs and cats and or animals, or they are so scared about some small events that they might just faint. Like if some teacher asks them to speak in class, it's not a dangerous situation. Okay, or it may be less dangerous, but you're still extremely afraid, and that can create a problem in adjustment to your daily life. A lot of people have phobia with blood. They can't see blood. Now obviously if they fall, or if they get hurt, and and they can't see blood, that causes a problem in regular adjustment in life. That's phobia. So then the individual will do anything to avoid it at any cost, and then um, it creates if it creates basically adjustment problems for more than 6 months, and if it is an intense and irrational fear, okay, that's the definition: intense and irrational fear. IIF. So you can remember it as PIIF. So phobia is intense and irrational fear. So that is basically phobia. There are different types like specific phobia, social phobia, and agoraphobia. Okay. Um, so that is phobia. Phobia can also be treated. There are very nice treatments available out there, and one of them is called systematic desensitization, the portion which is cancelled in your textbook, the learning bit from the previous chapters. So, but you can definitely deal with it. The next one is depressive disorders. Okay, the first one was anxiety disorders, which had phobia and GED. Now is depressive disorders. So, in the total population of 5 to 6% people suffer from mild depression. Okay, due to some negative incidences or some other external factors, individual may experience negative feelings, but if it continues for a very long time, then it is called depressive disorder. Very long as in it goes for 6 months, 2 years, more than constantly continuously going more than that, then it comes under depressive. So you may feel sad obviously if you lost something or missed something, or missed an opportunity, or failed, or broke up. Okay, but if that continues for extremely long, then it can be depressive disorder. So feelings of hopelessness, anxiety, and sadness are major feelings experienced in this disorder. Okay, extreme feeling of sadness, guilt, say at least for 2 weeks, it comes under depressive disorder. So I'll give you an example of people who feel depressed. They are in bed, they don't want to get up, they have no motivation to go out, go to college. They feel that there is no hope, they don't even want to reach out, don't even want to go to a counselor, because they feel that a lot, this is the extreme case of depression. Okay, they feel कि अभी life में कुछ hope ही नहीं है, nobody can help me, there is no hope, they feel hopeless, helpless, they think that nothing can happen. Okay, now the symptoms, that is what I've told you is the extreme symptoms. Okay, but in general it's not that bad. It can also be a little less than that. So symptoms are basically hopelessness, lack of enthusiasm, weight loss or increase of weight too, lack of interest in food or loss of appetite or excess appetite too, um, lack of sleep or excess sleep, constant feelings of fatigue, sadness, excessive feeling of guilt, sexual dysfunction, suicidal thoughts. Basically, you stop getting interested in things that you loved before. So you may have loved movies, but now you don't even like watching them. You may have liked having sex, but you're not even interested in sex anymore. So that all of these are a lot of symptoms of depression. Okay, you can't concentrate, etc. Now let's see bipolar disorder. This is also called manic depressive disorder. So in this, person feels alternative phases of extreme sadness, hopelessness, and stress at one time, and on the other time they suddenly feel very happy and enthusiasm and all of those things. So these are opposite conditions. The duration is not fixed. It could also be like 6 months of sadness, 6 months of happiness. It could also be like different times in the day, or there are a lot of different ways in which that can be felt. Basically, it is manic depressive disorder. The symptoms are alternate. Individual experiences alternative phases of two states. They are either extremely happy, sad, lost hope, get aggressive, irritable, etc. And genetic factors, imbalance in neurotransmitters in the brain, especially epinephrine, serotonin, and dopamine are one of the major causative factors in depression. So NESD, we've made this neurotransmitter ESD. Okay, like SSRIs, which are the common medications, are selective serotonin reuptake inhibitors. Basically, that's what they do in your brain. Serotonin is produced, but in depression, immediately it gets sucked back in. It's called reuptake. So it gets sucked back in. All that these medicines do is they stop that sucking, that process, the neurotransmitters like serotonin to go back into your neurons again. So they let them stay in your brain. That's why you don't feel sad all the time. It doesn't do anything to kind of produce these neurotransmitters. Okay. Now next is trauma and stress related disorder. The previous information was not for your exam. It's just to know that because there are quite a lot of students who kind of end up. That's why I mean, only and only if necessary, then I believe medication should be taken, because um, it doesn't kind of help you uh, do anything better for it. Just helps you not get extreme, or even in schizophrenia, it cannot cure it, but all it does is controls your aggressive behaviors and all of that. That's all it can do. Okay, the next one is, say, trauma and stress related disorders, when an individual is not able to cope up with the existing situation. So I'll just explain this to you. Imagine an elastic. Okay, uh, I'll show you. Wait. So just think of this. Okay, you have this much amount of stress. Okay, but you are kind of doing your best, and this is your amount of capability, and your workload becomes this. So what you have and what you're supposed to do, okay, that is when it becomes too much. That is the your ability is this, and your stress is your work is this. The thing in between where you have to stretch, that is called stress. So you're not able to cope up in a lot of times. Okay, so when you're not able to cope up with the existing situation, like you have certain amount of resources to cope with it, but your stress and tension and your situational demands are a lot more than that. That you can that can be related as stress related disorders. Daily problems, it can cause like a lot of things that can cause it are like daily problems, relationship issues, frustration due to non-fulfillment of desires, including sexual desires. Like in youngsters, this frustration is very common. So stress is not just because they have only to study, but see, there's too much restriction, there is no desire, frustration of desires such as sexual desires, or desire to meet people or to have social relationships, or the desire to even grow as an individual, have your own choice. All of these things lead to a lot of frustration. You may want to do something, your parents are forcing you to do something. All of these frustration occurs due to you can't fulfill your desire. Addiction, prolonged illness, all of these things lead to uh, uh, stress related disorders, like see, cutthroat competition. Especially in India, everything has cutthroat competition. Whether you want to get into college, whether you want to get into a job, anything that you have, constantly are facing this competition. So stress is inevitable, it happens anyways. If it is of moderate intensity, it's fine, it motivates the individuals. But if it becomes intense, for example, and it goes on for a very long time, then it can impair your capacity, to function normally. For example, war condition, serious accident, death of a loved one, sexual abuse, a lot of those breakups. Okay, they may create a very deep impact on your life, and may even be responsible for your illnesses like acute stress disorder and post-traumatic stress disorder. And see, in a country like India, if you have a lot of these problems like sexual abuse, or something that your parents abuse at home, and a lot of times when children go and tell their parents that, okay, this person has been abusing me, parents will tell the child, oh, aisi gandi baatein mat karo. I've seen that in a lot of cases for counseling. Or say breakup, parents firstly don't allow you to have a relationship. Now if you had a relationship, if you broke up, then you can't even go back to parents and tell them, oh, this is what has happened with me. For example, if you're at 12th standard and your other friends are studying, who do you go to? So that also adds to a lot of stressors. So these two major types of stressors are acute stress disorder, ASD, and post-traumatic stress disorder, PTSD. So let's see acute ASD. ASD is individual within 6 years or greater has experienced or witnessed extreme situation like death of a loved one, sexual abuse, or extreme fearness, like emotional numbness. That is, you don't feel anything at all. You don't cry. You're just, um, it's such a bad position that you're just numb. Okay, you can't feel happy. You don't cry. You don't express nothing. Severe confusion. You get dreams of incidents, or you get uncomfortable thoughts about it. You're not able to concentrate, sleep, you feel guilty, or even hold yourself responsible for something like, say, sexual abuse. You're not responsible for it, and you get into depression. All of these things come under ASD. Okay, you become irritable, emotional, unstable, alone. um, you prefer to stay alone, you don't want to take help of other people. Okay, and to diagnose it, it has to last for 3 days up to minimum, it has to be for more than 3 days up to 4 weeks, and persists beyond. If it persists beyond that period, it's called acute stress disorder. So up to then, up to 3 days to 4 weeks, it's fine. But if it persists beyond that, then it can come under acute stress disorder. So more than a month, you're going through the same feelings, too much stress, then it is ASD. The next one is PTSD. Although this is not enough for you to diagnose, we have a whole criteria and everything, but this is just the minimum criteria. Okay, the next one is PTSD, very common. All of these series and all of that also use it. Basically, more than 1 month, if you've had a particular uh, if the symptoms of ASD continue for more than 1 month, which with not much improvement, it can also be PTSD. Okay, now PTSD is basically you may have had some incidents in the past. Okay, like soldiers who came back from war, they had PTSD because they would wake up in the middle of the night, nightmares. Even if the war was over, they still had trauma and stress of the war after months and months and sometimes for years. So that was PTSD. Okay, so for PTSD, an individual who has suffered trauma goes through usually 3 stages. The first one is shock, where they are extremely disturbed, not able to think anything. He's in shock. For example, accidents ho gaye. Accidents are basically sudden. The whole family goes out and they're going to have fun for a picnic or something, and they meet with an accident and somebody dies. Starting is just absolute shock. You can't think anything. You may not even cry. You're just shocked, extremely disturbed. The second one is suggestible stage, where individual tries to find out how to get out of the circumstances by seeking guidance, asking, say, they are extremely extra sensitive to accept any suggestions. They're you if you just start giving them advice, ki aisa to hona chahiye, they're very sensitive. They might just not be comfortable. They might not take it. They might feel bad about it. Of those things. Okay, so they he may but they are also kind of not thinking, because they're in that stage, that if you also, like, if they randomly go to somebody and they say ki, ye kar lo, they might even do it without thinking of its consequences. Like some people might just say ki, oh, your son died, you know what, just do this, ye wale mata ye jagah ye mandir mein jaake is cheez ki bali chada do. I mean, they might just do it without thinking, or something like something else, that they might just say, "Okay, you go and start taking these medications on your own." People might do that, or somebody might just say, "Okay, take alcohol." They might just do it. Okay. The next stage is recovery stage, where the individual is still under stress, but now has started regaining his mental balance, and he does show some sign of recovery. However, some individuals still cannot maintain their mental balance. It's not very easy. So that is your PTSD stages. The next type of disorders are substance related and addictive disorders. Okay. Now, if you guys remember, I told you to make a kind of a summary of the whole chapter. So when you make a summary table, a flowchart table, you have to start with, say, psychological disorders, major psychological disorders, and then put them into different categories. Hold on, I'll show you. So you make this major psychological disorders, you write that down, and you divide it into categories like this. You make this flowchart. Over here, you will write anxiety disorders. Say, for example, here you will write mood disorders. Here you will write stress disorders. Okay, anxiety disorders may write all the anxiety disorders. Like here we have GAD and say phobia, right? Mood disorders may we have what? So you have to write here. Oh my God, it's very difficult to write using this, but write for mood disorders, bipolar. Stress may write ASD, PTSD. Okay, so I'm not going to write it. It looks horrible, but that will help you kind of give an overview of what all are the disorders that we have. Okay, so now we're going to the next one, the next form of disorder, which is addictive and substance related disorders. So in ancient time, this practice is very common. People used to make use of herbs. And any question? Okay. Does anybody has a question?
No, no, no.
No.
Okay. Okay. So they used to use herbs and to increase strength or enthusiasm, to reduce pain or sadness. That is to give like a euphoria kick. You feel happy. Okay. So there are a number of symptoms. Okay, which are there are a number of chemicals which may make you feel happy temporarily, like opium, hashish, ganja, charas, basic marijuana, heroin, all of these things. Okay, but the problem is that when a person gets habituated to it, he cannot stay without it. That's known as drug addiction. So even despite knowing that this is causing harm to my body and myself, they can't stay without it. That is called drug addiction. Okay, drug addiction is to the extent that a lot of people come from good families and still
Mm.
they go and steal. They go and steal. They will go and live on their own. They will do a lot of other things. Okay, now all of this will lead to major addictive they lead to a lot of uh, problems. They might be from good homes, they just leave it and they go and stay with outsiders because they need money for drugs. It leads to a lot of problems. Your family life breaks down, financial situation deteriorates. You may be very good at studies, but all of that is gone. Your mental, moral health, everything is affected. Okay, and you develop a dependence on those drugs. Even if you know that I'm going to die uh, doing this, you can't reduce it. And then there's a thing called tolerance. So once when you're having a certain amount of drug, and that's that that satisfies you. For example, you are having say 5 grams, 5 milligrams. Okay, and that satisfies you. Now for that gives you a satisfaction on say 0 to 10. It gives you a satisfaction of 10. The next time you will not 5 milligram will not satisfy you to 10. You will have to have 6 milligram in order to get a satisfaction of 10 on a scale of 0 to 10. So you have to constantly keep increasing the amount of your dose because you develop a tolerance. So now the same amount of drug doesn't basically make you happy, and then it becomes it creates a threat to his life. Can be tremors, loses control over body movements, and even may die. Okay, symptoms are excessive consumption of drugs, alcohol, can't reduce dosage, intoxicated all day. You want to you have a desire to consume substance again and again. Reduce social contacts, and you still consume your substance is despite your physical illness. And when it's contraindicated, you increase the dose or to get the same effect. So you have to take more drugs to get the same satisfaction. Are one of some of the symptoms of drug addiction. Alcohol Anonymous is a great place because this guy who made it, so they have two groups. One consists of ex-alcoholics and one of the present, and it's an emotional support group where everybody sits together. They share about their experiences, and people who are so it's a free service actually. And say a small group of people inside, and say they have so 6 ex-alcoholics and 6 current alcoholics. They sit together, and the people who've been they give motivation to these guys that you can leave it, you can leave it, and it's given great results. And now when these guys leave it in the future, they also come as ex-alcoholics and they come and set an example. Okay, so this okay, now let's go to schizophrenia. Very important. This guy Paul Eugene Bueller. Okay, just hold on, let me just check. We only have this left, so I'm going to get it done. This guy, Paul Eugene Bueller, he spoke of schizophrenia. Okay, and schizane means it comes from two terms: schizane, which means split, and phrene, which means mind. So split mind. It is not very easily seen among children. However, there have been cases. It mainly starts from adolescence and young adulthood. I think 19 is like a major age of extreme psychotic symptoms. Okay, it is more frequent in males. There are some major it has delusions, hallucinations, disintegration of language, thoughts, and words or emotions. So a lot of times when they speak, it doesn't make sense. They're talking about things like they're saying things like, I walking, Modi came, I was sleeping, he woke up, eating food, you're dancing, okay, all of those things. It makes no sense. Okay, it's disintegrated, language is not connected. Okay, yes. Now there are a lot of symptoms, positive and negative. Positive in any case, like, so for example, HIV positive means that you have HIV. Positive doesn't here mean oh, be positive, be happy. No, your positive means that there is an addition to the normal. So there is something that is added to your normal functioning. Okay, uh, so the first one is say hallucinations. Okay, hallucination is false perception in the absence of stimulus, which means that you experience something even when there is nothing present. Okay, you are hallucinating. That is, you are feeling that somebody is talking to you, someone's here to, somebody's doing something. So, for example, you feel that you're a doctor and you're constantly operating or talking to people, you're operating them. It could hallucinations could be visual, tactile, that is related to touch, related to smell, related to taste, or it could just be like internal sensation. Some people think that, I have a problem in my stomach. They go to the doctor, tell them, "Mujhe operation karna hi padega," although the doctor is saying there's nothing. But they are having hallucinations that nahi, mere stomach mein there is some one thing that you have to remove it. All of those kinds of things. Another is delusion, when an individual starts having a belief which is false, but the individual is not ready to change it, even if there is clear evidence against it. So, delusion can be, say, if somebody feels that this guy is coming to kill me, they believe that anybody who's coming at the door is coming to kill me. So, even if somebody knocks, they are ready with a knife because this man will come and kill me. Even if, there is contrary evidence that everybody who comes from the door is talking nicely to this person, still that person will think, no, this person will kill me. My wife is going to, everybody wants to kill me. They strongly start believing in that. The next one is disorganized speech and you lose association. So when you're talking, you jump unnecessarily from point to point. You can't, you're not organized in your speech. Okay. The next one is big behavior is disorganized. So bizarre movements, like you see, catatonic schizophrenia. A person might stand for hours and hours in one position, not move at all. They scream, run without reason. They do something without any reason. So, they start removing clothes in public places. They don't know. It's just bizarre movements. Okay. And the last positive one is a positive symptom is incongruent effect. So they have emotions expressed by individuals which does not match the situation. Okay. So they cry in happy occasion, laugh in sad occasions. Okay. And now the negative symptoms. I'm going to finish this because there are like a few minutes remaining. The negative symptoms are basically, they lead to low level of functioning and basically removing something. Quality of life deteriorates and it does not even improve much after treatment. So negative symptoms could be diminished emotional expression, lack of initiative or enthusiasm, diminished or reduced speech, and anhedonia. That is, you don't no experience of positive emotions. You become asocial and apathetic. Okay, that is, you don't feel any emotions. You don't express emotions. You don't express sadness, happiness. If someone's crying, it doesn't matter. If somebody's insulting you, no, makes no difference. Okay, so sometimes positives and negative symptoms both can be seen. If positive symptoms are seen for 1 month or longer, or if negative symptoms are seen for more than 6 months, a person can be diagnosed with schizophrenia. Now, identifying and treating mental disorder is very important. The earlier it is diagnosed, the better it is. There are few signs which are called red flags, and which can, if you immediately recognize these red flags, um, you'll be able to diagnose it more clearly. So many symptoms which are common among many disorders, and they go on for considerably long period of time. You have to you These may be some red flags. If you immediately reach out to a psychologist that you're seeing you're not getting interested in things that you were, you're feeling hopeless in life, if you start recognizing this, you get early treatment, and that can save you from a lot of pain. All of these red flags, I think it's good to remember at least a few of them, because that will show you how you can reach out. Okay. If you have these symptoms, it's important that you reach out for support, like inability to sleep, eat, not self harm, you're neglecting yourself, and all of those things. There are a lot of treatment modalities which can help with different disorders, like pharmacotherapy, various psychotherapeutic techniques like REBT, Gestalt, humanistic, interpersonal, family and couple therapy. For this stage, you just need to know the names. You don't have to know anything in detail. Okay, but we've discussed this when we were doing our normal regular class, so I'm not going to go into details of it. And after this session, we'll keep another session for question and answers right now if you guys want. Okay, but it's important that you seek professional help and get the required help. It's hardest when people assume that you can just get over it. It'll just get over. It